The Black Death, a devastating pandemic, swept across Europe in the mid-14th century, marking one of the most deadly plagues in human history. This disease, caused by the bacterium Yersinia pestis, originated from rodents, particularly rats, and transmitted to humans through the bites of infected fleas. This pathogen is responsible for various forms of plague, with the bubonic form being the most common during this pandemic. The transmission of the Black Death primarily occurred through these infected fleas. When the fleas fed on infected rats, they became carriers of the deadly bacteria. After the rats died, the fleas would seek out the nearest available hosts, which were often humans. This led to the rapid spread of the disease, particularly in urban areas where rats and humans lived in close quarters. The infection caused swollen lymph nodes, fevers, and chills, and could progress to pneumonic forms if the bacteria reached the lungs, making it transmissible from person to person through airborne particles. The rapid spread and extensive impact of the Black Death were due to several factors. Europe's urban centers had grown densely populated and were plagued by poor sanitation, which facilitated the proliferation of rats and fleas. Moreover, the extensive trade networks of the era, such as the Silk Road, played a crucial role in spreading the disease across continents by transporting infected rats and fleas in ships and caravans. Medical knowledge in the 14th century was not advanced enough to combat such a virulent disease. The lack of understanding of disease transmission meant that responses were often misguided and ineffective. The societal impact of the plague was profound, leading to panic and social disarray that further hampered effective response and isolated the sick. This plague not only had a catastrophic death toll but also led to significant socio-economic changes, disrupting the feudal system and altering the course of European history. The long-term consequences of this pandemic were profound, influencing the landscape of public health and urban planning to prevent future outbreaks. The legacy of the Black Death is a testament to the interaction between human societies and disease dynamics, highlighting the importance of public health and the need for vigilance in monitoring and controlling disease vectors. The Black Death, the bubonic plague that ravaged Europe, Asia, and Africa in the mid-14th century, stands as one of the most devastating pandemics in human history. This deadly pandemic was responsible for an estimated 75 million to 200 million deaths, decimating about 30% to 60% of Europe's population at the time. The plague had profound impacts across the continents, leading to widespread economic decline and severe depopulation, particularly in urban areas where dense populations and poor sanitary conditions facilitated the disease's spread. Efforts to prevent the spread of the Black Death were rudimentary, reflecting the limited medical knowledge of the time. One of the first measures adopted was quarantine, a practice that originated in the Venetian-controlled port of Ragusa. Ships from infected ports were required to sit at anchor for 40 days before landing, a practice aimed at ensuring no active cases were on board. This early form of quarantine was one of the pioneering public health responses to a pandemic. Additionally, isolation became a common practice during this period. Infected individuals, and sometimes entire towns, were isolated from the healthy population in an attempt to contain the spread of the plague. Houses were often marked to indicate the presence of infection, and in some severe cases, entire households were sealed off. Public health measures also included the establishment of health boards in some cities, which oversaw the emergency response to the epidemic. These boards could make decisions about the burning of infected belongings and the whitewashing of houses to maintain cleanliness. Mass graves became a grim necessity due to the high volume of deaths, reflecting changes in burial practices aimed at handling the mortality rate efficiently and reducing the risk of further transmission from corpses. Advice on personal hygiene and avoidance of the sick circulated, suggesting that people understood the importance of cleanliness in combating the spread of the disease, even if the scientific underpinnings of such measures were not yet understood. Despite these efforts, the effectiveness of the measures was limited by the lack of understanding of the plague's transmission mechanisms. It was not until later that the role of fleas on rats in spreading the disease was discovered, leading to more effective interventions in subsequent outbreaks. The Black Death thus not only reshaped the demographic and social landscape of the medieval world but also spurred some of the earliest public health interventions, laying foundational concepts that would evolve into modern public health measures. The response to the Black Death marked a turning point in how societies manage epidemics, highlighting the critical role of public health in survival during pandemics. The Black Death, caused by the bacterium Yersinia pestis, continues to persist in the modern world, although it is much less common than during its devastating sweep in the 14th century. Today, the plague is primarily found in rural areas across Africa, Asia, and the Americas, with a few thousand cases reported annually. Countries like the Democratic Republic of Congo, Madagascar, and Peru are known to have endemic pockets of the disease. The approach to preventing the plague today combines public health strategies, individual precautions, and advances in medical treatment. Effective management involves the surveillance and control of rodent populations, which are the primary reservoirs for the bacterium. Reducing the habitats and food sources for rodents diminishes the risk of plague transmission. Additionally, controlling fleas through the use of insecticides and treating domestic animals reduces the chance of these vectors passing the disease to humans. People in high-risk areas can take personal precautions such as wearing long pants and using insect repellent to prevent flea bites. Avoiding contact with animal carcasses and being cautious in environments where plague could be present are also crucial preventive measures. Rapid diagnosis and treatment are key in managing plague cases and preventing outbreaks. Modern antibiotics are effective at treating the plague, and early medical intervention can significantly reduce mortality rates. Public education plays a vital role in prevention, as awareness of how to recognize symptoms and understanding when to seek medical help are essential for community health safety. Through these measures, public health authorities can maintain control over plague incidences, ensuring that while the disease has not been eradicated, it remains a manageable health concern rather than a widespread public threat. Advances in medical science, including the development of vaccines for high-risk populations, further support the efforts to contain and control the plague effectively.